Hello, hello, hello. Good evening, students. Good evening. Am I visible to all? Am I audible to all? From where we are streaming? Uh, yes. Okay. So we are live now. Thank you all of you for joining in. Just a second, if you can, audio, video is all clear. Hello, hello, hello. Yes. And can somebody also type something in the chat box so that I know that the chat function is also working. It's going to be a very fabulous session. Welcome all of you to our very important session. In this session, we are going to discuss the topmost 50 expected one-liners in obstetrics. And even though it's a one-liner, I'll try to give you a lot of extra information also with this. Okay. Yeah, hi Ritabrata. Yes. Okay. So the chat function is also working. Is the audio video all clear? Yes. Thank you very much. So welcome all of you. Good evening. I'm the OGGuru Dr. Punit Bhojani here with a single agenda to make OBGY your most favorite subject and most scoring subject. And for all of you, those who are preparing for the upcoming NEET PG examination can get in touch with me on phone and WhatsApp on this number. I'm personally guiding all the students how to study, how to prepare. And all of you can quickly download the OGGuru app on the Play Store as well as in the app and iOS. If you are using iOS, do not forget to put this ORG code YYMSTV. Okay, and what you are going to get is superb lectures. I can assure you that even when the students walked out of NEET PG last year, they said that, sir, among all 19 subjects, my best performance was in OBGY, and same thing will happen with all of you, that when you will walk out of the upcoming NEET PG examination, you will message me that, sir, among all 19 subjects, my best is OBGY. I've got theory lectures, rapid revision MCQ, mock test, my personalized timetable guidance, and beautiful handwritten notes, which also I'll be showing you later on. So download the OGGuru app and you can go for just the 6 months preparation. Happy to announce that you can see the testimonials, read it for yourself. Every student was extremely happy with the lectures, and you will remember things for a long time, and that will help you retain it in the examination also. And this is the Republic Day sale offer, the coupon code Republic40 to get you the maximum discount. So all of you can quickly download the OGGuru app, WhatsApp me on this number for your personalized timetable guidance, and let us begin. I want it like a rapid fire kind of a thing. Yes, but definitely, Natasha, you please WhatsApp me on the number given to you. I'll definitely guide you what you should do to improve your GT score. Also, definitely, I'll guide you. Okay. And you can just take the 6 months masterclass for OBGY. It'll really boost up your preparation, because OBGY major subject 20 to 22 MCQs. Go and check the recall video, whether it was morning session or evening session. Everything was from my lectures only. And very, very important, let it be like a rapid fire round. I want all of you to answer in the chat box. Okay. Right, wrong does not matter. Okay, so it's going to be like a KBC style, kaun banega crorepati style. Chalo, the first shooting for the day, top 50 going live now. Earliest to detect pregnancy. Anybody? What in the whole world? Is it a blood test? Is it a urine test? What is in the whole world to detect a pregnancy? Okay, we just said pregnancy. Okay, anybody? And similar question I am going to ask you, so that these are the confusing questions which you get in the examination. Okay, now tell me, I'll give you all the answers together, and now tell me, anybody, what is the earliest to detect live pregnancy? Now, can anybody tell me the difference between the two type of questions? Yes. Yes, all of you please answer. Right, wrong does not matter. We are here to learn from our mistakes. If you make a mistake, it is okay. So what is the earliest to detect pregnancy? Is it ultrasonography? Is it the urine pregnancy test, or what it is? Anybody? Please, all of you answer in the chat box so that we know whether you're understanding or not. Yes, anybody with the answer? Okay, so now please understand that, that when we first answer, yes, UPT. Okay, no, Natasha. Okay, so please pay attention that UPT, I'm very happy. Okay, so urine pregnancy test, what we do at the kit. Okay, that ad comes, Prega Sure, Prega News, वो 2 बूंद यूरिन का जाता है, हीरोइन का ad आता है. Okay, there are various models. Okay, Kareena Kapoor and Shilpa Shetty and Anushka Sharma were the brand models for that Prega kind. And वो ऐसा 2 बूंद you put, and 2 बूंद खुशी के, 2 बूंद जवानी के, ऐसा. So that urine pregnancy test detects urine urinary HCG, but that is positive only after missed periods. Only after missed periods will this urine test be positive. Even before that is your serum beta HCG. Okay, because serum beta HCG blood test is positive even before the patient misses her period. Okay, is this understood to all of you? So clap if you have learned something new. That sir, the serum beta HCG can become positive as earliest. Implantation takes place on 21st, 22nd day. 48, 24, 40 days from 22nd, 23rd, 24th day, the beta HCG is positive. You can predict. You can tell the lady that, hey, you are pregnant and you're not going to get the periods, you're going to miss your periods. So please understand this, that the earliest to detect pregnancy is your serum beta HCG. Yes or no? Is this understood to all of you? So don't make a mistake. Serum beta HCG, not urinary. Okay, is it clear? Rita, Brata, Natasha, all of you. UPT will become positive afterwards. Now, very good. The next important point is the live pregnancy. And for live pregnancy, very good. I need to do the demonstrate what? Fetal cardiac activity. Baby बोलता है जिंदा हूं मैं, जिंदा हूं. Okay, so that only comes with the transvaginal sonography earlier. Can anybody tell me? Yes, Happy Sharma understood. Yes, serum. Yes, thank you, Happy Sharma. So you will learn lots of new things. Okay. So can anybody tell me transvaginal sonography? How earliest can it detect the baby heartbeat? Okay, and very important MCQ, it recently came in the FMG exam also, surely likely coming it. Yes, very good, Sushil. Okay, first sign of pregnancy on ultrasonography. So whenever anybody is pregnant, whenever any lady is pregnant, the first thing what we see inside the this is the gestational sac. Okay, it's a G sac. So first sign of pregnancy on ultrasonography, gestational sac. When anybody is pregnant, the first thing what we get is at around 4 weeks and 5 days is when we see the gestational sac or the G sac as the answer. Very good. The fetal cardiac activity, very good, Sushil, is at 6 weeks. Traditionally, with a newer machine, we can remember even as early as 5 weeks, 5 days. Okay, 5 weeks, 5 days is what we can remember. Okay, just a second. Yeah. Okay, so 5 weeks, 5 days is when the just give me a minute, students. Just give me a minute. This the pen, I think. Just give me a minute. Just give me exactly 1 or 2 minutes better. The stream is slightly, yeah, the pen has stopped working. I need to. Okay, yeah. Sorry for that technical glitch. Sorry, students. Thank you for holding on. Certain things are beyond my control. And just a second. Yes. Okay. So, thank you. Yes. Can anybody, is the chat box all working? Yes, yes, yes. Thank you very much. Okay. So, we'll quickly go. Yes. So, everybody, we were discussing three very, very important MCQs. Okay. And I will just quickly repeat for the benefit of those who have joined in late also. The important part is that earliest to detect pregnancy, as I was explaining you, is the blood test, the serum beta HCG, not the urinary pregnancy test. Is this clear to all of you? Urine test will become positive afterwards. Serum beta HCG is positive even before the missed periods. Is this understood to all of you? And earliest to detect live pregnancy, yeah beta, we are going to that. So in live pregnancy, I have to demonstrate fetal cardiac activity, and that is by transvaginal sonography. Traditionally we say 6 weeks, but with newer machine, even as early as 5 weeks, 5 days, the heartbeat can be detected. Okay, Natasha, the trans-abdominal did the same thing 1 week later. So when I look at the trans-abdominal sonography, this 6 weeks can become 7 weeks, and this 5 weeks, 5 days can become 6 weeks, 5 days. Is this understood to all of you? And first sign of pregnancy on ultrasonography, yes, gestational sac or the G-sac is the first sign of pregnancy for any patient. When you look at the ultrasonography, we get a proper circle which is slightly eccentric. Can anybody tell me the second sign? Chalo, extra knowledge. So gestational sac, as short form G-sac, that is always the first sign. Now can anybody tell me what is seen second? Quickly, what is seen after the gestational sac? Okay, what is seen after the gestational sac? The second structure. Beta, ink pot, I am in third year. How to, beta, surely beta, you please WhatsApp me on this number. I'm personally guiding the student. Ink pot, please, after my this is over, please WhatsApp me and I will definitely guide you. Very good, Rita Brata. Okay, so ink pot, please definitely WhatsApp me on the number given. I'll definitely guide you. Yes, very good. The yolk sac, sparkle, shine, excellent. The yolk sac is the second structure. Circle ke andar circle is the yolk sac, and then attached to the yolk sac we get a fetal pole, and inside the fetal pole we get the heartbeat, which is the fetal cardiac activity, which is telling me it is a live pregnancy. So I hope all of you are going to crack it. Clap if you feel happy. Earliest to detect pregnancy, serum beta HCG, but live pregnancy, transvaginal sonography, and first sign is your this. Okay, moving on. Chalo. Extremely important topic, trisomy 21. Trisomy 21, that is Down syndrome detection in the first trimester. T1 is my short form for first trimester. Anybody, what is the screening test available in the first trimester? Anybody, can you tell me? What is the screening test? Read the question correctly. So mistake students kahan pe karta hai? They are not reading, whether it's first trimester, second trimester. Anybody? No, sparkle, shine. Quadruple marker test is wrong. Why? Because sir, the quadruple marker test, anybody? So extra knowledge. Sir, quadruple marker test is done between 16 to 18 weeks of gestation, which is our second trimester. Okay. Similarly, the triple marker test is also done at 16 to 18 weeks. Okay, Rita Brata, yes, the screening test in the first trimester is the dual marker test. Dual marker. All these are extremely important MCQs, have been asked in the past and surely coming to come in the future examination also. Now can anybody tell me what is the confirmatory test in the first trimester? So I'm not only giving you directly answers, I can just give only one answer. I'm giving you explanation also so that you understand the lecture. And please share this video with all your friends and colleagues, and do not forget to subscribe to the YouTube channel and also follow me on Insta. Lots of interesting stuff coming every day. Yes, very good. PAP A and HCG dual marker में होता है. By the way, in dual marker we do HCG and PAP A. PAPPA, pregnancy associated plasma protein A. Okay, HCG plus pregnancy associated plasma protein A. Very good, Dr. Rafa. Excellent, Rafa. Okay, please understand this. The confirmatory test in the whole world is karyotyping. Karyotyping is the confirmatory test because we need to detect trisomy 21, and in the first trimester, very good, Rafa, we do a chorionic villus sampling, which is done towards the end of first trimester, 11 to 13 weeks. Is this understood to all of you? And no beta Natasha, USG is not confirmatory. Okay, and NT scan, very important. NT scan, what is the NT scan? NT scan क्या है? Nuchal translucency scan. The nuchal translucency scan is done at what week? So no, sparkle chan थोड़ा बढ़ाना पड़ेगा. 10 weeks is early. We do it between 11 to 13 weeks. Anybody with a normal value of NT, okay, and what happens to the NT in Down syndrome? Is it more or less? And nowadays, extra information, PG level, NBNT. What is NBNT scan? Sir, NB, very good. NB is nasal bone because absent nasal bone. So you also check for nasal bone. And NT up to 3 millimeters. Yes, very good, Raj. Up to 3 millimeter is considered normal. Some say 3.5. Overall, NT more than 3 millimeters or more than 3.5 millimeters is definitely on the higher side, and it is suggestive of Down syndrome and absent nasal bone. So nowadays we call as NBNT scan. Is it understood to all of you? And now suppose one more extra information. If I say confirmatory test done in the second trimester, okay, what is the confirmatory test in the second trimester? Chalo, now what is the answer? Yes, beta Natasha, more than 3 millimeters. Yes. Anybody? Confirmatory test in the second trimester. Confirmatory test in the second trimester is what? Yes, absolutely correct. Ajiz Raj, the confirmatory test. Yes, beta, Pooja, hold on. Okay, the confirmatory test in the second trimester is amniocentesis. Basically, to remember karyotyping. So, karyotyping in the second trimester preferably done through amniocentesis. Is this understood to all of you? All correct. Very good. Rafa, Natasha, Sparkle, clap. Okay. So, OG in the chat box if you are enjoying, and I want all of you to participate. Confirmatory test in the first trimester, chorionic villus sampling. Confirmatory test in the second trimester, amniocentesis. Moving on. Extremely important. Chalo, what are the signs of pregnancy? Early pregnancy clinical signs, extremely important, is also going to come. Okay, so I'm going to give you the names of the sign, and we are going to have 6 signs in the next 1 to 2 minutes time. Can anybody tell me what is the Jacquemer sign? JACQUMIER. Jacquemer sign क्या होता है? Anybody? What is Jacquemer sign? What is Osiander sign? Anybody? What is the Shadwick sign? Okay, Jacquemer Shadwick. Okay, yes, very good, Raj. Goodell, Shadwick, excellent. Palmer. But now, excellent, all of you. We should also know what are the signs. Okay, so now clap if you feel happy. I'm going to give you a trick for the Goodell sign. Okay, Goodell sign. And all this, please understand, we practically very rarely see, but they are asking you in the exam. Okay, so please understand this. If you do a PV, non-pregnant cervix feels like the tip of the nose. All of you palpate the tip of the nose, slightly firm. Okay, and pregnant cervix becomes like the lips. Pregnant cervix is soft because of the hormonal changes and the congestion. Okay, so non-pregnant cervix like the tip of the nose, pregnant cervix like the lips. Okay, and lips should be soft, right? Isn't it? If you are unlucky, it will be other way around. Unlucky for you, for your partner, it will be other way around. But if the lips are soft, it is good. Yes or no? Yes. So that's the Goodell sign. Okay, because if the lips are soft, it is good. Good for all of us. Okay. Yes, Goodell signs are very good, Pooja. So this is your softening of the cervix. आप याद रखोगे because it feels like the lips. Okay, and what is Osiander sign? Sir, when I do PV examination, we will see the pulsations. Okay, pulsations in the lateral fornices, that is the pulsations of the uterine artery, and bluish vaginal discoloration is your jacquemer. And anybody, what is the Hagar sign? Okay, what is the Hagar sign? The Hagar sign is, sir, when I do a very good puja, when we do a bimanual examination, then my both the fingers will approximate at the isthmus. That is the Hagar sign. Okay, and very rarely I'll show you that in asymmetry, if it's a very early pregnancy. Okay, so all of you please pay attention. Very important table, 5-star table. Surely questions are going to come for it. The jacquemer sign or Chadwick sign, everybody rightly told. So it's called jacquemer or Chadwick. Forget the second column. We need not remember the second column. Sir, bluish vaginal discoloration or vascular congestion which we get in the vagina, that is the jacquemer or Chadwick. The Osiander sign, as I told you, is the pulsations in the lateral fornices. Okay, the pulsations which you feel in the lateral fornices, that is the Osiander sign. Okay, Goodell sign, I told you, when the cervix becomes soft, softening of cervix, that is the Goodell sign. Okay, and Hagar sign, bimanual examination, approximation of the fingers, and Palmer's sign, regular rhythmic contraction during the bimanual examination, early pregnancy. The only last one, as I said, very theoretical, Pisca cake sign. Anybody? When do I see the Pisca cake sign? Okay, where do we see the Pisca cake sign? Okay, so all of you pay attention. Again, very theoretical. So suppose it is a pregnancy, and suppose it's a lateral implantation. The pregnancy is implanted on one side. Absolutely theoretical. Practically, if we don't demonstrate it, that, sir, then if the baby is on one side, so when I do a PV examination, this side of the uterus will slightly appear bigger. Okay, and this will slightly appear smaller. So what is Pisca cake sign? Anybody? Sir, Pisca cake sign is asymmetrical uterine enlargement seen when? In lateral implantation. That is your Viva and that is your MCQ clap. Okay, lateral implantation. Of course, the pregnancy move. Dhire pregnancy will come in the center, and finally the pregnancy, all of us know, is an example of a symmetrical uterine enlargement. Is this understood? Clap. Okay, so I repeat, okay, sir, in Pisca cake sign is a asymmetrical enlargement of the uterus seen in lateral implantation. Is this understood to all of you? So sir, when I have a lateral implantation, that's a very early pregnancy, then I get the Pisca cake sign. Okay, yes, beta, that is in early pregnancy. Finally, it is going to come in the center. The pregnancy is going to move in the center and we are going to get symmetrical. Okay, so I quickly repeat, jacquemer or Chadwick, Osiander, Goodell's, Pisca cakes, and your this. Okay, moving on to the next part. Okay, yes. Okay, yes. Now anybody, okay, prostaglandin used for cervical ripening. Very important MCQ. Which prostaglandin? I'm giving you option. Is it E1, E2? Which prostaglandin is used for cervical ripening? Okay, so remember the brand name also. If you enter final year student, the drug kept on your Viva table. What is the brand name of that gel? Anybody? We get a gel with the brand name Cervi Prime. Very good. Okay, Cervi Prime gel. Cervi Prime is a brand name. Anybody? But it is basically your PGE2 gel. Okay, Cervi Prime gel is a PGE2 gel. Cervi Prime gel. Okay. Yes, Cervipram gel, PGE2 gel. Okay, again, this, I'm very sorry students, today this has never happened in my live stream anytime before, but today is I think a day of not, which is, I'm not sure how this is working, but there is slight issue. I'm very sorry. Just hold on for a minute because the pen is getting stuck, and this is really sorry, very sorry for the issue. Just give me. Yes. Okay. So we are live now. Sorry. Yes, there was. I'm very sorry for this issue. It never happened before. Yes. Okay, and we were on the, we have finished the 6 early signs. All of you can quickly come back. And yes, so cervical ripening, very good. It is because of the gel. Very good, Dr. Salma Raza, and all of you have, no, it's not PGE1. Okay, so all of you pay attention. The cervical ripening which we do, dinoproston gel. Okay, dinoproston is the PGE2 gel. Okay, PGE2 is called dinoproston. Dinoproston is PGE2. Okay, PGE1 beta can also be used, but more commonly used, or the most commonly used for cervical ripening, is your PGE2 gel. Okay, misoprostol we prefer to do for MTP and PPH. Yes, it can be used for induction of labor, but primarily remember, Dr. Salma Raza, that for cervical ripening I require dinoproston gel, which is PGE2. Okay, now anybody, what is the contraindication for PGF2 alpha? I would want absolute contraindication. Very important PYQ. It has also been asked in the past. Anybody? What is the absolute contraindication for PGF2 alpha? And can anybody tell me, where do I use PGF2 alpha? Sir, PGF2 alpha can only be used, PGF2 alpha. Very good. Beta Ritabra, cervical ripening is to make the cervix soft, to prepare before induction. Okay, before I go for induction of labor, we will call it, cervix will become ripen, cervix will become soften. Very good, Somshra. And yes, bronchial asthma. The reason being that, okay, bronchial asthma, it is a bronchoconstrictor, and I can never use a PGF2 alpha. And anybody, yes, PGF2 alpha we have got only for PPH, never use it for induction of labor. Only for PPH we can use it, but the absolute contraindication is bronchial asthma. Absolutely correct. And can anybody tell me what is the contraindication for methergin? What is the contraindication for methergin, also called as methyl ergometrin? Methyl ergometrin. Anybody? What is the, yes, okay, yes. Anybody? So what is the contraindication for methergin, methyl ergometrin? You will remember it is, yes, heart disease. Why? Please keep in mind, because it is a vasoconstrictor. It can increase the preload, afterload, heart disease, and also hypertensive disorders. So remember, preeclampsia, eclampsia, very important, my dear. So very good, Dr. Rafa. So remember this, that heart disease and hypertensive disorder, preeclampsia, any heart disease, and preeclampsia, eclampsia, I will never use methergin. Again, remember, methergin should never be used for induction of labor. It's only for PPH. So you will remember two, okay? Heart disease and hypertensive disorders. Moving on to the very good Jit. Okay, moving on. What is the dose? Excellent, very difficult. Finally, MBBS students, distinction, gold medal, and surely coming virgin MCQ. Anybody? When I do active. What is AMTSL? Active management third stage labor. Active management third stage labor. What is the dose of oxytocin? Remember here, my dear student, we are going to give 10 units. That's the dose. No, never bolus beta sham. When you never give IV bolus, sudden crash, and we have to give it intramuscular. Excellent, Rafa. Okay, so 10 units intramuscular is a dose when we are giving active management third stage labor. That is for prevention. Very, very simple, very, very basic. What is the first drug of choice for PPH, postpartum hemorrhage? Anybody? As per the WHO criteria, again remember, oxytocin. Okay, oxytocin is considered the first drug of choice. Okay, for the management of PPH, or when actual PPH is happening. Here we will want to give it IV. We will give it IV. Okay, yes, but again never bolus. Okay, we will give it in a drip form, diluted, and we will give it IV. Okay, and how much we use? So we'll use more, 20, 30, 40 units. Okay, 20, 30, 40 units is what we use. Keep that in mind. Okay, but we will give it drip and IV. Beta, which criteria? Beta, I don't know. WHO criteria. Beta, as per the WHO. Okay, WHO, ACOG, all. Okay, whether it's WHO, ACOG, RCOG, all of them, WHO, all criteria are saying that first drug of choice for PPH should be oxytocin. Okay. Now, Bakri balloon tamponade. Anybody? What is this Bakri balloon? Okay, now to say it stylishly, because friends, Bakri. Don't say Bakri, say Bakri. Bakri balloon. What is this Bakri balloon? Please keep in mind. Bakri balloon is a ready-made balloon. It is a catheter. It is a catheter, and there is a balloon at its tip. And here you will fill up the saline. And when the PPH is happening, you put this device inside the uterus and you start filling the saline. So this balloon will expand, 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 and give a tamponade effect. That is called as the Bakri balloon tamponade. Very good. No beta jeet. Okay, it's the capacity 500 ml. Very important MCQ, surely coming in the future exams. Okay, we have got the Indian variation also. Anybody? What can be used instead of Bakri balloon? So Bakri is a foreigner, Western idea. We can also use a condom tamponade. Okay, condom tamponade can also be used. Condom tamponade can also be used. Okay, moving on to the topic. Anybody? What is the most common malpresentation? Any idea? The most common malpresentation is what? Very good. Shivkar's pack. Yes, the most common malpresentation, is it brow, face, breech? Yes, sir, breech. The word used is malpresentation, breech. Breech is the most common malpresentation. Okay, yes, very good, excellent. But if I ask you, no Jeet, okay, yahi pe mistake. What is the most common malposition? Yes. Then when I say position, remember my dear students, I am talking about the position of occiput. So majority of the time, it is occipito anterior. Occipito anterior is considered normal. So when it is occipito posterior, that becomes a malposition. Is this understood to all of you? So don't make a mistake. And in this also, anybody, what is more common, LOP or ROP? Clap if you feel happy. Okay, so here the most common malposition is occipito posterior, and ROP is more common compared to LOP. Very good. Okay, so occipito anterior is normal. So remember this, most common malpresentation word आया, breech mark करना है, malposition आया, occipito posterior. Now anybody, what is the most common cause for breech? Why should a breech presentation happen? Yes, very good. Okay, why should a breech presentation happen? Okay, so remember, starting में बहुत सारे babies are in breech, then the baby spontaneously rotates, and therefore prematurity is the most common cause for breech. Other causes are the polyhydramnios, oligohydramnios, but the early delivery, prematurity is extremely important cause for our, yes, Ritavrata, yes, Somsha. Now, anybody, external cephalic version to be done at when? Anybody, if I give you option, 28, 30, 32, 36 weeks, when do we do? When do we do an external cephalic version? So, external cephalic version is to be done. Okay, don't do it at 32 to 34 weeks. Please remember, we will do it, yes, very good, 36 to 37 weeks. We only should do it after 36 completed weeks. So 36 to 37 will give you a range in the exam. That's the best answer to mark. Why not do it early? Because sir, if I do it early, the baby can again turn on its own. तो क्या फायदा है? And you have to wait. Give baby a chance to rotate on its own. वरना क्या होगा? आप घुमा, you rotate the baby, baby will again turn. You rotate the baby, baby will again turn. Okay, so please wait till 36 to 37 weeks. And then only if the baby has not rotated by itself, then you can try to intervene, and then you can try to do it. Okay, and in our detailed lectures, we are giving you also the contraindications, what are the complications, all that, yes, and to prevent a iatrogenic prematurity also, because if while rotating the baby heart rate drops down, have to do a cesarean section. Okay, yes. Now in ectopic pregnancy, what is the most common site? Yes sir, fallopian tube is the most common site. And inside the fallopian tube, can anybody tell me what is the most common site? So inside the fallopian tube, the ampullary part is the most common site. Is this understood to all of you? Now, which ectopic pregnancy is the earliest to rupture? Very good. So if I give you the options, isthmus, ampullary and interstitial, which is very good? Which is the earliest? We are talking of ectopic only. Okay, we are talking of earliest ectopic, and we are talking of the tubal ectopic. In the tubal area, isthmus. Okay, isthmus is the earliest to rupture. And can anybody tell me which is the last to rupture? Very important. And why? There's a reason for it. Which is the last to rupture? Okay, yes, very good Jeet. Usse better usko kya bolenge? Yes, please understand, the first part of the fallopian tube is called the interstitial. Why? Because sir, this part is within the uterus, so it has got some extension property, the intramus. So this is called as what? So it will, okay, so this will keep on growing, and this, so this is called as the interstitial variety. Interstitial variety can rupture at around 16 weeks. Very good. So last to rupture is your interstitial pregnancy. Okay, so remember, ampullary part is the most common in the tubes. First to rupture, last rupture, all MCQs are surely going to be asked. Now, anybody, when we have got, yeah, abdominal may not, okay, preferred treatment in an unruptured ectopic pregnancy. Anybody, what is preferred? Do I do a surgery? What do we do in a unruptured ectopic pregnancy? Anybody? Extremely important MCQ every year, almost it is coming, and we should know the preferred treatment is methotrexate injection. Yes, very good. Medical management we prefer to give, and we prefer to give methotrexate injection. Intramuscular we prefer to give, and that is the preferred wherever possible. And what should be the criteria? What should be the criteria? Anybody, what should be the criteria when I want to give methotrexate? Of course, sir, patient should be stable. It should be an unruptured ectopic, so it should be a stable patient. And in a stable patient, the gestational sac, remember, should be less than 4 centimeter. And the gestational sac is less than 4 centimeter, and the beta HCG initial level is less than 5,000. Okay, 5,000. Yes, very good. Okay, 5,000 micro international units per ml. That is the time when we can go ahead and give the methotrexate treatment. Okay, if it's a ruptured ectopic, of course I have to go in for immediate surgery. So gestational sac should be less than 4 centimeter, HC level less than 5000. Please remember this criteria. Short MCQ, yes, and preferably cardiac activity should be absent. Is this understood to all of you? Quickly, all of you, before we move ahead, all of you, do not forget to follow me on Insta and quickly follow and subscribe to the YouTube button and subscribe to me, and also join on the Telegram. We'll also be posting the annotated PDF also. Picture abhi baki hai. Okay, do not leave. Yes. Now anybody, Doppler machine, when I hear with the heartbeat, fetal heart sounds can be heard by Doppler. This is your Doppler. Bada sa black box comes in the OPD. Thak 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 thak. Not the stethoscope. Okay, I already told you transvaginal sonography is when. Okay, I told you, sir, by transvaginal sonography we are going to get the heartbeat at 5 weeks 5 days to 6 weeks. That is what you mark. But the Doppler machine is going to pick it up as early as 10 weeks. Is this understood to all of you? Yeah, 10 weeks, beta. Jeet, that is stethoscope. And with stethoscope, when I want to hear with a stethoscope, okay, stethoscope will pick up at 18 to 20 weeks. Okay, 18 to 20 weeks is when the stethoscope can pick up the baby heartbeat. So, 4 sawal, 4 jawab, don't make a mistake. 4 MCQs discussed. Now, anybody, again, what is the number of antenatal visits recommended by WHO? Ideal number. Anybody? How many visits is the WHO recommending? So, older criteria, please remember, was with 4 visits, and now how many visits are going to be there? Please understand, 8 visits. Okay, so please understand this. That is called contact. So the first contact can happen in the first trimester, then 20 weeks, 26 weeks. Very good. But Jeet, 4 was the old criteria, and then at 30 weeks, 34, 36, 38, 40 weeks. So this is, it's called contact. Very good. So this is a very important MCQ. Overall 8 visits is what the WHO recommends as per the latest criteria. Old was 4. Okay. Is it clear to all of you? So minimum number is 8. And very important, what is the recommended folic acid dose for neural tube defect prevention? Anybody? For prevention of, the question is neural tube defect prevention. That means when the patient is planning pregnancy, we have to give 400 microgram in the periconceptional period. Is this understood to all of you? Very good. But if I twist the question, yeah beta, Som Shubhra beta, the tablet contains 500 microgram, but the overall, the tablet which Government of India is giving, but the recommended dose you have to follow is 400. Question asked. Okay, if it's a PSM MCQ, that how much the folic acid tablet is containing, then is a separate thing. But remember this. And if a patient already has a history of neural tube defect, anybody, if there's a first time history of neural tube defect, then this 400, yes, previous risk, yes, very good. Then I have to give 4 milligram. 400 microgram, yes, 400 microgram will now become 4 milligram. So 2 separate MCQs. Clap if you have learned something new. OG in the chat box if all of you are enjoying the session. Yes, moving on to the very simple, not 4 gram beta, 4 gram nahi beta, 4 milligram, yes. Anomaly scan is done when? The single most important, it is also called as TIFA scan. Final year student, answer this in your Viva for distinction. TIFA, targeted imaging for fetal anomaly. It's a stylish word. खाली नया stylish, just for boasting in style मारने के लिए Viva में. So TIFA scan. Okay, yes, TIFA scan anomaly. Yes, very good. The anomaly scan is done between 18 to 20 weeks of gestation. Single most important. No beta. So NT scan is 11. Yes, 18 to 20 weeks is traditionally we do it. If at all later I want to do a fetal 2D echo, okay, that's again a PG level stuff, then fetal 2D echo can be done thoda sa late. That is only in specific cases, like when we want the fetal 2D echo, that can be done between 22 to 24 weeks. Is this understood to all of you? Yes. Now, what is the drug of choice for impending eclampsia? All of you know eclampsia. Eclampsia drug of choice. Beta, yes, beta. Anikesh Agrawal, please WhatsApp me on this number immediately after the session is over. I'm going to guide you personally, and the masterclass FMG is the best for you, and you'll be able to get all the marks in OBGY is my guarantee. Okay, Anikesh? So quickly note down the number and message me after the stream is over. I'm going to personally guide you. Okay, yes, very good. So यहाँ पे the important part is कि not only for eclampsia, even for impending eclampsia, the answer is the same, magnesium sulfate. Prophylactically we give magnesium sulfate. And anybody, what is the therapeutic range of magnesium sulfate to be achieved? The therapeutic range, we are going to keep the magnesium levels 4 to 7 milli equivalents per liter. Very, very famous MCQ. And can anybody tell me how much, what all things we monitor? Very important. What all we monitor when the patient is on magnesium sulfate? So we monitor the knee jerks, we monitor the respiratory rate, and we monitor the urine output. Urine output should be how much? One more MCQ. Urine output should be how much? It should be at least 25 to 30 cc per hour. Okay. Very, very important. Chalo, all of you answer. Yes. Moving on. KB test. Tough MCQ. Okay. Claire Howe Bedke test. KB test is for what? Okay, KB test is for what? So ulta पूछ सकते हैं. They'll give you the other part and then they'll ask you the name of the test. Claire Howe Bedke test. Okay, so it is to quantify the feto-maternal hemorrhage. How much blood from the baby has entered into the mother, so I can calculate the dose of the anti-D. Practically never done, only theoretically remember. That's sir, normally, what is the anti-D? Yes, feto-maternal hemorrhage. We want to quantify the feto-maternal hemorrhage. We use this. No, beta, Rafa, wrong. Vasa previa nahi hai, beta. Vasa previa ke liye we have to do color Doppler. Okay, please remember. Okay, Rafa, Vasa previa color Doppler is the investigation of choice and not this KB test. Okay, yes, anti-D dose calculation. Okay, now, maximum blood loss, what can happen during vaginal delivery to be classified as PPH? Very simple, but yes, sometimes could be asked to you. Okay, so when I want to do for PPH definition, and what is the blood loss for PPH definition? Yes, sir, when it is more than 500 ml. Blood loss more than 500 ml. The question asked is vaginal delivery, and if it is LSCS, the definition is going to be, okay, the definition is going to be more than 1 liter. Okay, more than 1 liter or more than 1000 ml. Very good, all of you. So very basic MCQ, but you should also know the basics also. Sometime very simple one-liner. Chalo, again, normal fetal heart rate. Normal fetal heart rate is how much? Okay, normal fetal heart rate 120 to 160 is the old criteria. Remember, 120 nahi hai, 110 to 160 per minute. Okay, don't make a mistake. Anything less than 110, fetal brady. Anything more than 160 is the fetal tachycardia. So normal baby heart rate is 110 to 160 beats per minute. Do not make a mistake in this. Now, when you have a cardiotocography, when do we get a early deceleration? Anybody? We are going to also show the images in our actual class. We show the images of this types of deceleration. Anybody? Early deceleration, when do we get? Okay, the early deceleration we are going to, when the baby's head touches the pelvis and the pelvic floor, baby's head, we get head compression. Head compression, we are going to get early deceleration. Is this understood to all of you? And what does the late deceleration indicate? No, beta, Jeet. Okay, very good. Okay, the late deceleration is indicative of, yes, uteroplacental insufficiency, UPI. Okay, uteroplacental insufficiency हाथ रखना है, और also your fetal distress or fetal hypoxia. Is this understood to all of you? No, Sushil, yes. And chord compression में कौन सा होगा Sushil? Chord compression में we are going to get variable deceleration. Okay, variable deceleration you get in chord compression. So all the three done. So it's actually 50, but if you go back home and calculate, we have done more than 65, 70. Okay, we are not going to discuss 50 top liners. Yes, very simple. This final year student, you should know this criteria for reactive NST. Anybody? So what is the criteria? Sir, we do the NST for 20 minutes normally, and there has to be a good beat to beat variability, and there has to be an acceleration. And कितना acceleration होना चाहिए? Anybody? The heartbeat should increase by at least 15 beats. That means, sir, suppose the baseline is 130, it should at least go till 145. Okay, heartbeat should increase by 15 beats per minute, and acceleration start हुआ, top तक गया, खत्म हुआ. This acceleration should last for at least 15 seconds or more. Okay, so please by heart this 2. Okay, 2 or more accelerations. 2 or more accelerations in 20 minutes time, each being 15 beats above the baseline and lasting for 15 seconds or more. Is this understood to all of you? That means, just by the way, just to tell you that suppose the sir heartbeat goes up and comes down only in 5 seconds, this is not counted as an acceleration. Clap if you have learned something new. Okay, heartbeat should go up, peak and come down. This should at least be 15 seconds, more than or equal to at least 15 seconds. Yes. Now, anybody, what is the normal biophysical score? BPP. Very, very important. So the normal biophysical profile score, BPP score, when do I consider it normal? So totally, my dear students, BPP has got 5 components. Each is given a score of 2 or 0, and therefore the normal BPP score is 10 by 10. 10 by 10 matlab baby is takatak. Okay, and as the score is becoming lesser, 8 by 10, 6 by 10, it is indicating fetal distress, and baby is getting distress, and we need to, okay, we need to deliver the baby out. So BPP tells us how to deliver and when to deliver. Okay, yeah, Rafa, but there are totally, that is if you're considering only 4, but totally there are 5 criteria. So you have to give a score of 2 or 0, and that are the 5 criteria. Okay, so remember 10 by 10 is a normal score. Now, what is modified BPP? To save time. Okay, to save time, we do only NST and AFI. NST and AFI is what? Amniotic fluid index and non-stress test. Okay, so that is your modified BPP. So all these are extremely high yield MCQs which are going to be asked to you in the exam. So modified BPP. And can anybody tell me what are the 5 things on BPP and how do we measure? Anybody? BPP के लिए और क्या लगता है? One is the NST machine. NST is a part of it. Yes, anybody? We are coming to this in a minute. Anybody? What is the, yes, NST I do, and then we check the fetal movements. We check the fetal breathing movements. We check the fetal tone, and we check the amniotic pocket around the baby, or amniotic volume, okay, or amniotic pocket in one of the quadrants. Okay, is it clear? Now can anybody tell me, very, very important, who will count the fetal movements when we are doing BPP? When we are doing biophysical profile, who will count the fetal movements? Intern, doctor, neighbor, husband, mother. Who will count the fetal movements when we are doing BPP? Anybody? Anybody? When we are doing a biophysical profile, who will count the fetal movements? Okay, so this is a very important mistake which students make. Student tell me mother, wrong. Please understand this, the mother will count the fetal movement is called the fetal kick count. That is separate. That is the mother who will count. okay, and not the neighbor and definitely not the intern. Very good. No, Sushil, okay. Here, all these things are done on ultrasonography. Very good. Okay, Natasha. And so, okay, so the radiologist or the sonologist, so NST is one, and fetal movements, fetal breathing movements, fetal tone, amniotic, all this is with the help of ultrasonography, has to be done for 30 minutes. Is this understood to all of you? Clap if you have learned something new. So don't make a mistake. Fetal kick count is separate from fetal movements. Very important. Last year AIMS MCQs has come in the AIMS. Okay. Very simple. Milk ejection reflex. Milk ejection reflex is because of which hormone? Anybody? Milk ejection is because of oxytocin. Okay, oxytocin is going to cause the contraction in the baby suckles. Oxytocin is released, and that is going to be the answer. Okay, moving on. Which antihypertensive is contraindicated in pregnancy? Short MCQ बहुत बार आता है. And what is the drug of choice for hypertension? Okay, so when you look at the drug of choice, labetalol. Okay, labetalol is the drug of choice or antihypertensive. Alpha methyl dopa was the old answer. And what is contraindicated? Sir, ACE inhibitors are absolutely contraindicated. So anything which is going to end with pril, yes, enalapril, captopril, in the option mark that. Okay, ACE inhibitors should not be used. Anybody? Why? Because they're going to affect the fetal kidneys. Fetal renal blood flow can get affected. Okay, and there could be the problem of IUGR and other complications. Okay, and very important, HELP syndrome. What are the criteria? So H is hemolysis, EL is elevated liver enzymes, and LP stands for low platelets. Okay, so hemolysis, elevated liver enzymes, and low platelets. Now, how many low platelets? Low platelets matlab how much low? Anybody? Yes, very good, Rafa. Oligohydramnios. Yes, renal, fetal renal and oligo. Very good. Yes. So what is the criteria? All of you remember, my dear students. Low platelets matlab less than 1 lakh. Less than 1 lakh. But it should be, okay. Okay. Okay, so please understand this. What should be remember this is, okay, for hemolysis, there is the elevated in the bilirubin and absent plasma. Haptogram, please by heart this value is very good. Okay, please remember this, that SGOT more than 72, LDH more than 600. This also could be asked to you. So it was MCQ 2-3 years back in the PYQ. And low platelets, absolutely everybody has said less than 1 lakh. Okay, so I want you to remember the other criteria also, which are there: LDH more than 600, SGOT more than 72. Okay, yes. Now, very important, what is the DIPSI test? Anybody? Moving on, DIPSI test क्या क्या है? Diabetes in pregnancy study group India. Short MCQ. Virgin till now. DIPSI word is virgin till now. Diabetes in pregnancy study group India. Okay, so it is the India study group India, Indian guidelines. Clap. And what is the glucose load over here? We are going to give 75 grams. 75 grams. Okay, is this understood? So all those who have learned the DIPSI full form, be happy and clap. Okay, and now we have to remember, very good. And one step, this challenge what we gave, glucose challenge, what is the threshold or what is considered as normal, and beyond which we say it is GDN. Okay, so one step when I do the glucose challenge test, or it's also called the OGTT or this DIPSI test, basically remember that 140, it should always be less than 140. If it is more than 140, okay, if it's more than 140, then it is a case of gestational diabetes. Okay, so less than 140 milligram per DL, please keep in mind. Now, very important, 2 MCQs. Anybody? Chalo. Most specific anomaly in the baby of the diabetic mother. Most specific anomaly. Yes, all of you correct. Most specific anomaly in the baby of the diabetic mother is what? Okay, And one more googly question, most common anomaly in the baby of the diabetic mother. So two confusing MCQ, students, clean bold. Yes, yes, yes. Very good. So yes, Dr. Rafa, Shomushubra. Okay. So the most specific anomaly is caudal regression syndrome, also called as sacral agenesis. Okay, sacral agenesis is the most specific. It's not at all most common. Very good. But when you get the most common anomaly, very good. So cardiovascular is the most common, and therefore ventricular septal defects, absolutely correct. VSD. Beta TGA beta not transfer. Okay. TGA beta is the most specific cardiac anomaly. Okay, Dr. Rafa. So cardiovascular system gets affected first, followed by number 2 is neural tube defects. In cardiovascular, VSD. Okay, so ventricular septal defect is the most common anomaly. Is it understood? The transposition of greater is the most specific cardiac anomaly. So this is how they fool you in the exams. Okay, so I hope all of you, okay, so this is very, very clear. Most common anomaly, CVS, followed by neural tube defects. Okay, so all of you quickly download the OGGuru app, and all of you can take the 6 months. We have got a 6 months masterclass. We are going to get the 6 months masterclass in the only at 1509. Okay, with the Republic Day sale, it's 1499 plus 10 rupees platform. 1509 is what you're going to get it. So please make use of it. You're going to get the best score. OBGY will become your most favorite subject and most scoring subject is my guarantee. It's going to have theory lectures, rapid revision MCQ, beautiful handwritten notes. I'm going to show you all of you can check out the notes. All students have told me that, sir, once we have finished the videos, we can revise the entire notes in just 2 hours time. Completely color coordinated and absolutely superb, easy to read. And all of you you just have to study 2 hours every day. Everybody's don't get hassled by the 65 hours of video. Basically everybody sees the video at 1.5 speed. So just 2 hours every day, and in the next 20 days, okay, just 2 hours every day, you will be able to dedicate to OBGY. You will become champion, and within the next 20 days time, you will become the expert and master of OBGY is what you can do. And Republic Day sale, as I told you, use this coupon code of Republic 40, which is going to give you the maximum discount. Do not miss out this opportunity. And of course, I'm there to help you, guide you how to study, how to prepare. You can download the OGGuru app on the Android and on the iOS. Do not forget to put this app, this ORG code YYMSTV, and also do not forget to hit the like button. Please comment how did you like the video. We will also be coming out with a top 50 one-liners in gynecology also very soon. Okay, so please subscribe to the YouTube channel, follow on Telegram, and also follow on Insta, where every day we are putting lots of interesting stuff. Okay, so wishing you all the best for the upcoming exam. That was actually, if you go back and check, we had said 50, but more than, I'm sure, 65, 75, 80 one-liners we have done. These are some of the most important one-liners in the field of obstetrics. Of course, the gynecology video also I'll try to come out in the upcoming weeks and give you like this kind of a session for the top 50 in gynecology. Okay, and do not forget to subscribe to the YouTube channel, share this video with all your friends, and get in touch with me on phone and WhatsApp on this number. This is bye-bye, best of luck, thank you very much, and wishing you all the best for upcoming examination. Thank you very much.